Hello everyone. Welcome to an introduction of your MNPS Support Employee Benefits. Today I will give you an overview of your benefits and explain how to enroll for coverage. As a MNPS Support Employee, you're offered benefits through Metro Nashville government. There are two types: core benefits, where you and Metro share the cost, or the cost is paid completely by Metro, and optional benefits, where you pay the full cost at group rates. For medical coverage, Metro pays 75% of the cost. You pay 25%. For dental, Metro pays the full cost of employee-only coverage. If you elect family coverage, you pay the cost of that. I'll go over your retirement benefits a little bit later on, but Metro does provide a 100% pension for you. You make no contribution to the plan. Finally, Basic Life and AD&D provides coverage equal to $50,000. This plan is paid for by Metro. We'll also go over your optional benefits, which include a vision plan, short and long-term disability, supplemental and dependent life insurance, and the flexible spending accounts. To enroll for benefits, you must complete several enrollment forms, which were emailed to you along with this presentation and your benefits guide. You have two options for returning your completed enrollment forms. You can print the forms from the email, complete them, scan or take a photo of the completed forms, then email them to kelsey.marshall@mnps.org. Or, if you're unable to print, you can call Kelsey at 615-259-8462 and request paper forms to be mailed to your home address. You can then take a photo of your completed forms and email them to kelsey.marshall@mnps.org. You must return your completed enrollment forms within 30 days of your hire date. Your coverage will be effective on the first day of the month following one full calendar month of employment, and your insurance premiums are then deducted through payroll deductions each pay period. If you don't return your benefits paperwork within 30 days of your hire date, you will be automatically enrolled in the Blue Cross Blue Shield PPO medical plan and the dental flexible plan at the employee-only level. Once in these default plans, you will not be able to make changes to your coverage until annual enrollment in the fall, or if you experience an eligible change in status, which I'll discuss later in this presentation. You may only opt out of medical coverage if you provide proof that you have other non-Medicare medical insurance. You must provide a copy of your insurance card or other documentation of coverage. Again, if you fail to enroll for medical coverage and don't provide proof of other coverage, you will automatically be enrolled in the Blue Cross Blue Shield PPO medical plan and the dental flexible plan at the employee-only level, and you will not be able to make changes to coverage until annual enrollment in the fall, or if you experience an eligible change in status. If you opt out of Metro's coverage but wish to enroll later, you can do so at a future annual enrollment or within 60 days of an eligible change in status, which I'll discuss in a minute. Regular full-time employees who average 20 or more hours a week are eligible to enroll for benefits. Eligible dependents include your spouse, as long as you're not divorced or legally separated, your domestic partner, and your dependent children from birth to age 26. Your dependent children can be married or unmarried as long as they are a child by birth, adoption, legal guardianship, or your stepchild. You may also cover children for whom a qualified medical child support order has been issued. If you wish to enroll your domestic partner for benefits, there are certain documentation rules you must follow, and those enrollment forms are not included in your benefits welcome email. To enroll a domestic partner, you will need to contact Metro Human Resources at 615-862-6700 and make an appointment to provide the necessary information. You can also visit nashville.gov/HR to see a list of frequently asked questions about domestic partner benefits. Now, a word about changing your benefits. Once you enroll for benefits, you generally can't change them during the year unless you experience a life event, also called an eligible change in status. Examples include getting married or divorced, having a baby, or losing other coverage. So, for example, if your spouse loses their job, you can bring them onto your insurance. You have 60 days from the date of the event to contact the benefits office and make the change to your insurance. If you do not contact us within 60 days of the life event, you'll have to wait and make that change during the next annual enrollment. Every fall, you get the opportunity to review and change your coverage for the upcoming year. This is called annual enrollment. You will receive an annual enrollment packet at your home address from Metro government. Any changes made during annual enrollment will be effective January 1st of the next year. If you do not make any changes, your insurance remains the same for the upcoming year, with one exception. You have to re-enroll for the FSAs every year to keep participating. Now for medical insurance. Metro offers you a choice of 2 medical plans. Both plans provide similar benefits, but there is a big difference in the way the benefits are covered and paid for. The first option is the PPO, administered by Blue Cross Blue Shield. This plan is an 80-20 coinsurance plan, which means that most non-preventive services are covered at 80% when you use network providers. In addition to coinsurance, copays are also required for office visits. There is no deductible if you use network providers. And the maximum amount you'll pay out of pocket for services during the year is $1,000 if you are enrolled in employee-only coverage, or $2,000 if you are covering any eligible family members. There is one exception to the out-of-pocket maximum. Copays for medical and prescription drugs do not count toward this, but more on that in a moment. The second option is HRA Choice Fund, administered by Cigna. This plan combines traditional medical coverage with a Metro-funded health reimbursement account, or HRA fund. The fund, provided by Metro, allows you to pay for medical and pharmacy claims before you have to pay your share of the deductible. Neither plan requires you to get referrals to go to specialists. And if you use in-network providers, you will receive higher benefits in both plans. Now, let's go into more detail on each of these plans. Metro's PPO is a coinsurance plan, which means after you pay the required copays, the plan pays 80% of your medical claims and you pay the remaining 20%. Copays are $20 for primary care office visits, $30 for specialist visits, and $100 if you go to the emergency room. The plan covers preventive care at 80% for children ages 6 and under. For adults and for children 7 and older, preventive care is covered at 100% up to $750. Any amount over $750, the plan pays 80% and you pay 20%. You'll pay a $10 copay for generic drugs and a $30 copay for brand name drugs. And remember, you will continue to pay copays even after you've met your annual out-of-pocket maximum. Your other medical plan option is the HRA Choice Fund. This plan includes a health reimbursement account, or HRA for short. If you choose the HRA Choice Fund, Metro will put money in an HRA fund for you each January 1st, or on your eligibility date if you're a newly hired employee. You can use this money to pay for medical and pharmacy expenses before you pay anything out of your own pocket. If you elect employee-only coverage, Metro will put $1,100 in your HRA fund. If you elect family coverage or employee plus children coverage, Metro will put $2,200 in your fund. If you spend all the money in your HRA fund, then it's your turn to pay for expenses out of your own pocket until you meet the annual deductible. The deductible is $450 for employee-only coverage and $900 for family or employee plus children coverage. After you meet your deductible, you'll pay 10% coinsurance for medical expenses and generic drugs and 30% of the cost for brand name drugs. If the amount you pay out of pocket reaches the annual out-of-pocket maximum, the plan will pay 100% of eligible expenses for the rest of the year. The HRA Choice Fund covers preventive care at 100%. Let's take a closer look at how the HRA Choice Fund plan works. We'll look at employee-only coverage first. Think of this plan as having phases. The first phase is the $1,100 HRA fund provided to you by Metro. When you have a medical claim or get a prescription filled at the pharmacy, the full cost of that medical claim or prescription will be paid out of your HRA fund. For example, if a doctor's visit costs $80, that amount will be paid out of your HRA fund. And if you go to a doctor that is in Cigna's network, you won't owe anything at the time of the visit. The same applies to prescription drug expenses. The full cost of the drug will be deducted from your HRA fund when you pick it up at the pharmacy. And because providers that are in Cigna's network have agreed to charge discounted rates for eligible medical and prescription expenses, your expenses are reduced when you use Cigna's network providers. You can see doctors that are not in Cigna's network, what we refer to as out-of-network providers, though you will pay more out of pocket for these services. Depending on the medical services or prescriptions you have during the year, you may not even use your entire HRA fund. In that case, any fund dollars you have remaining in your HRA account at the end of the year will roll over to be used in the next year. If you do spend all your HRA fund, you'll move to the deductible phase and pay the next $450 of your medical and pharmacy expenses at the time you receive the services. After your deductible is met, you'll move on to the coinsurance phase, where you'll pay 10% of your medical claims and generic prescriptions and 30% for brand name prescriptions. Once you've paid $700 in coinsurance, you will have met your annual out-of-pocket max and will have 100% coverage for the remainder of the year. Remember, regardless of the phase you're in, all preventive care is covered at 100%. This means the cost of an annual physical or well care is not deducted from your HRA fund or applied to your deductible or coinsurance. The HRA Choice Fund works the same if you elect family coverage or employee plus children coverage. First dollar medical and pharmacy expenses will be deducted from your HRA fund. Once you deplete your HRA fund, you'll move into the deductible phase, where you'll pay the next $900 in expenses toward your deductible. It's important to remember that you'll pay the full cost of any medical services or prescription during this phase. So if you take an expensive medication, when you are in the deductible phase, you'll have to pay the full cost of that drug at the pharmacy counter. After you meet the deductible, you'll move into the coinsurance phase, where you'll pay 10% of your medical claims and generic prescriptions and 30% for brand name prescriptions. If the amount you pay in coinsurance adds up to $1,400, you'll have met your out-of-pocket maximum and will have 100% coverage for the remainder of the year. And again, all preventive care is covered at 100% regardless of what phase you are in. This includes well baby care, annual physicals for yourself and your covered dependents, immunizations, annual mammograms, and even expenses like routine colonoscopies. And remember, any fund dollars you have remaining in your HRA account at the end of the year will roll over to be used in the next year. New employees who enroll in the HRA Choice Fund and have an insurance effective date of April 1st or later in the year will receive prorated HRA funds the first year. If your coverage is effective January through March, you'll receive the full HRA fund amount. If your insurance becomes effective in April, May, or June, your HRA fund will be prorated at $825 for employee-only coverage or $1,650 for family or employee plus children coverage. The later in the year your insurance becomes effective, the less money Metro will deposit into your HRA fund that first year. The following January 1st, the full amount will be deposited in your HRA account. The HRA Choice Fund plan comes with several optional incentive programs to allow you to earn additional HRA dollars each year. Incentive dollars can only be earned by you and your spouse or domestic partner. Dependent children can participate in these programs, but they are not eligible to earn incentive dollars. Earned incentive dollars will be deposited into your HRA fund. These dollars are over and above what Metro puts in your HRA fund each year. First, the health risk assessment. By taking a 15-minute, completely confidential health questionnaire, you'll get a personalized health profile and earn $100 that'll be added to your HRA fund. Your spouse or domestic partner can also take the assessment and earn another $100 for your HRA fund. If you have a chronic health condition such as diabetes, asthma, depression, low back pain, a heart condition, or COPD, you can receive personalized support from a Cigna health coach. If you complete Cigna's program, you will earn $100 in your fund. There are 2 additional Cigna incentive programs. If you participate in the Cigna Lifestyle Management Program and receive coaching for tobacco cessation, stress, or weight loss management, you'll receive $50 per person in your HRA fund, up to a maximum of $200 per family. The last program is called the Healthy Pregnancies, Healthy Babies program. It's designed to help you and your baby stay healthy during pregnancy and encourages early prenatal care. You'll earn $150 if you enroll before the end of your first trimester, or $75 if you enroll by the end of your second trimester. You must complete the program to receive the incentive. Participation in all 4 of these incentive programs is simple and helps keep you on track for a healthier lifestyle, all while earning additional dollars for your HRA fund and offsetting your deductible. Here are your biweekly premiums for the calendar year, which are deducted from your paycheck each pay period on a pre-tax basis. The amount you pay is based on 3 things. 1, the plan you choose. 2, the level of coverage you elect, employee only, employee plus children, or family coverage. And 3, whether you work a 10-month or 12-month schedule. Please note that premiums are based on your work schedule, not on how often you get a paycheck. So, for example, if you choose the HRA Choice Fund, Family Coverage, and you work a 10-month schedule, you will pay $345 per paycheck. Regardless of which medical plan you enroll in, you have access to an incentive program offered to Metro employees and their dependents that can save you money. When you seek care from Nashville General Hospital or Meharry Medical Group for services such as primary care visits, specialist visits, lab work, and physical and occupational therapy, you pay no copays or coinsurance if you're enrolled in the Metro PPO plan. If you're enrolled in the HRA Choice Fund, you must exhaust your HRA funds first. Then there would be no copays, deductibles, or coinsurance to pay. Under either plan, waived copays, deductibles, and coinsurance don't count toward your annual out-of-pocket maximum. Here's a more detailed list of services offered by Nashville General Hospital and Meharry Medical Group. For more information, you can contact them at the phone number and email address listed here. Another way to access high-quality health care at a low cost are the MNPS Employee and Family Health Care Centers. There are 5 locations across Davidson County, including the Employee Wellness Center in Berry Hill. The healthcare centers are staffed by Vanderbilt health providers. I won't go over all the details here, but you can visit the website at mnpshealth.org for more information. There is a short video on the website that gives you an overview of their services. You have two dental plan options, both offered through Blue Cross Blue Shield, the flexible plan and the limited plan. With the flexible plan, you can see any dentist you choose. Preventive care like cleanings and x-rays is covered at 100% with no out-of-pocket expense. More extensive services are covered at 80% or 50%, depending on the service you need. The flexible plan has a $1,000 annual maximum benefit per member. That means once you've received $1,000 in benefits, the cost of any other services will be out of pocket for the rest of the year. With the limited plan, you must use network providers. There are no benefits for out-of-network care. There is also no annual limit on benefits. Benefits are based on a predetermined schedule. In general, the limited plan pays a higher level of benefits than the flexible plan, but the limited plan has a few more limitations, like it doesn't cover TMJ or implants, and again, it doesn't cover out-of-network care. Both plans cover 2 cleanings per year at no cost to you. If you elect employee-only dental coverage, Metro pays the full cost, so you will not see a premium come out on your paycheck. If you elect family coverage, you will pay the amount shown here through payroll deductions. As I mentioned before, basic life and AD&D insurance equal to $50,000 is provided by Metro at no cost to you. Do you know what AD&D coverage is? AD&D insurance provides additional coverage above any other insurance benefits in the event of accidental death or dismemberment. If you die as a result of an accident, it basically doubles your life insurance benefit. If you suffer a dismemberment accident, such as the loss of an eye or limb, the plan pays a percentage of the full benefit amount. You will need to name a beneficiary for this coverage. This is the person who will receive benefits in the event of your death. This coverage is provided through Prudential. Optional benefits are available to provide you with a measure of financial protection and security. You pay the full cost of any coverage you elect at group rates. And, like your core benefits, premiums are made through payroll deduction. Vision coverage is offered through National Vision Administrators, or NVA. With this coverage, an annual eye exam costs $10 when you use a network provider. You may choose from the basic plan and the enhanced plan. The enhanced plan pays a higher level of benefits and covers new glasses or contacts more often, but you pay more in paycheck deductions for this plan. Here are your premiums for the 2 vision plan options. As a new employee, you have a one-time opportunity to enroll in supplemental life, dependent life, and/or long-term disability without having to provide proof of good health. In other words, without answering health questions. If you have a health condition that might preclude you from being approved by the insurance company, you should consider enrolling in these plans now. If you wait and decide to enroll later, like at annual enrollment, you'll be required to answer health questions and be approved by the insurance company before coverage is effective. Let's look at supplemental life and dependent life first. These plans allow you to supplement your Metro-provided basic life insurance and add coverage for your family. For supplemental life, you may purchase up to $200,000 in coverage in increments of $10,000. For dependent life, you can elect either $10,000 or $20,000 for your spouse or domestic partner. When you do, your dependent children are automatically covered for $5,000 each. You must enroll in supplemental life in order to purchase dependent life insurance. Here are your supplemental life premiums. They are per month per $10,000 in coverage. So say you're 24 and want $20,000 in supplemental life. You'll pay 50 cents per $10,000 in coverage, or $1 a month. This is then prorated for your biweekly paycheck. And here are your premiums for dependent life. So, if you elected $10,000 for your spouse, your children would also be covered for $3.76. Now, let's look at disability coverage, starting with short-term disability. Short-term disability continues 60% of your Metro salary if you become disabled and can't work because of an illness or an injury. These benefits begin after a 7-day waiting period and may continue for up to 6 months. Short-term disability does not require you to provide proof of good health, but if you don't enroll for this coverage now as a new hire and choose to add it later, you will be subject to a late enrollment penalty where the waiting period is extended from 7 days to 60 days for any condition other than accidental injury. Short-term disability premiums are based on your Metro salary. For instance, if you make $15 an hour, your monthly premium will be $16.80. This amount is then prorated for biweekly paychecks. Long-term disability generally picks up where short-term disability leaves off. If you elect this coverage, benefits began after 6 months of continuous disability. This plan replaces 50% of your Metro salary. Certain rules and limits apply. Long-term disability premiums are also based on your Metro salary. For instance, if you make $15 an hour, your monthly premium would be $8.06, again, prorated for a biweekly paycheck. Disability coverage is designed to protect you financially if you become ill or injured and can't work. Whether you need short-term disability, long-term disability, or both is a personal decision. But remember that long-term disability benefits do not begin until you've been totally disabled for 6 months. Next are the flexible spending accounts. If you have kids in daycare or have predictable healthcare expenses, you'll want to listen to this because I'm going to show you how you can pay for these expenses tax-free, which can save you up to 30%. That's a pretty big savings, but participation does take a little planning. The FSAs are administered by WageWorks. They allow you to set aside a portion of your salary, tax-free, to reimburse yourself for many types of expenses not covered by insurance. In other words, it's a way to pay for common expenses like medical care and child care tax-free, saving you money. Metro offers 2 tax-saving FSAs, the Health Care Account and Dependent Care Account. You can use the Health Care Account to reimburse yourself for many out-of-pocket healthcare expenses not covered by your medical, dental, and vision plans. Examples include amounts paid toward deductibles and copays, prescriptions, and some over-the-counter items prescribed by your physician. You can contribute a minimum of $240 or up to $2,850 per year. Your annual contribution is prorated by the number of paychecks you will receive in that year. The FSAs run on a calendar year basis, from January 1st through December 31st. You can enroll now to save on expenses through the end of this year. So, for example, if your coverage effective date is September 1st, you simply estimate your expenses between September 1st and December 31st, and elect to contribute that amount. Then you can enroll again during annual enrollment for the upcoming calendar year. Regardless of what type of medical insurance you have, if you know you will have out-of-pocket healthcare expenses during the year, you should consider contributing to the healthcare account. Say you anticipate having $1,000 in out-of-pocket expenses, so you elect to put $1,000 in your healthcare account. That amount will be withheld from your paycheck in equal amounts over the calendar year, and be deducted before taxes are taken out. If you incur eligible medical expenses, you submit a claim form and your receipt to WageWorks. You'll be reimbursed out of your FSA account by check or direct deposit. If you have eligible pharmacy expenses, you can use the FSA debit card you'll receive in the mail after enrollment, and the expenses will automatically be deducted from your healthcare account. The dependent care account works the same way as the healthcare account. You estimate your dependent care expenses for the year and decide how much you want to contribute, as little as $240 per year or as much as $5,000 per year. Then you would reimburse yourself with the tax-free money. But you do want to plan your contributions carefully, because if you do not use your FSA dollars by year end, you forfeit them. That wraps up our discussion on optional benefits. Before we close out, let's quickly review your pension plan and some other programs. First, your retirement pension program. As I mentioned earlier, this benefit is paid for entirely by Metro. You do not make contributions to the plan. There is a 10-year vesting requirement. This means you must have at least 10 years of service with Metro to receive pension benefits. This vesting requirement applies to employees hired on or after January 1st, 2013. Normal unreduced pension benefits begin after age 60 once your age plus years of service equals 85. We call this the Rule of 85. You can retire as early as age 50 and receive a reduced benefit as long as you have at least 10 years of service. If you are vested and eligible to retire, you may also be eligible for retiree medical benefits. Premiums are based on your credited service with Metro. Metro also offers two types of disability pension benefits: medical disability and in line of duty. Both pensions are 100% paid by Metro. You do not contribute to the plans. To qualify for medical disability, you must have 10 years of service. In line of duty or IOD benefits begin immediately if your disability is because of a work-related injury. The amount of disability pension benefits is 50% based on your last 12 months' earnings. If you worked for Metro Nashville government previously and have now returned, you may be able to connect your previous service once you complete 1 full year of continuous service in your new Metro job. By connecting your previous service to your current service, you'll receive a greater service pension. You can contact Metro Human Resources at 615-862-6700 to get more details about connecting your service. So, what happens if you are injured at work? As soon as the injury occurs, you're encouraged to report the injury to your immediate supervisor or department safety officer. You will be instructed on what to do next. We're almost done. A quick word about privacy. All of your personal and health information is protected by federal HIPAA privacy regulations. If you have any questions about the privacy of your information, you can contact Metro HR. Welcome to MNPS. If you have any questions, I encourage you to bookmark this phone number, email address, and the Metro HR Department website. We're more than happy to answer any questions you have. Thank you for listening, and have a great day.